Good morning, everybody. This is Kimberly Bjorn with Elevate Health, and we will be starting in about 5 minutes.
Hi, Kim. Miles here. Looks like a lot of people are still joining and are figuring out their audio setup. Several people are muted, but I believe they will be with us here shortly.
Thank you, Miles. Good morning, everybody. I see people starting to settle in and come in. It's great to see. Linda, I see your face. Nice to meet you. And we'll be starting shortly.
Good morning. Glad to be here.
We have quite a few people that have signed up, so they'll probably come drifting in throughout the 3 hours.
My apologies there, Kim. You don't have to mute. We're getting lots of people joining and being admitted at the same time, so I accidentally clicked on asking you to mute. You're currently muted, Kim.
No worries. I'm just making sure the poll is ready to go. Yeah, people are starting to get in. It's great. Good morning, everyone. We'll be starting very shortly. Good morning, Taylor. I appreciate you having your camera on. Nice to meet you.
Yeah, thank you for having me. I figured I'm at a fun skate shop. I should at least have
Yeah,
the camera on.
absolutely.
Kim, this is Miles here. It looks like we're at 50 participants. Please ignore that request to mute. I accidentally clicked it again. My apologies there. How many are we expecting today?
I believe we have quite a few, 110 I had registered, and then Cheyenne had another, I think 75. So, but there were some duplicates there. So I'm gonna assume around 120 or so. And they can come in anytime.
Got it.
So they might come out since it's a 3 hour, but it is 9 o'clock, and we do have a very packed agenda. So I would like to get us started.
All right, I will be on the lookout and I will admit people as we go.
Thank you, Miles. We appreciate it.
Cheers.
So welcome everyone to our Opioid Summit for 2021. And I am going to start off with our first poll question. For those of you, I should introduce myself. So I'm Kimberly Bjorn. I'm with Elevate Health, and I'm one of the great MCs today, along with Elizabeth Allen, which is who's with Tacoma Pierce County Health Department. We have a small but mighty steering committee that pulled this off this year, and we're excited that you're here. So our first poll question is, what group do you identify most with today? And I was limited in my groups, so there may be that you don't identify with any of the groups listed, and I have other there. So please, if you can, if you end up hitting other, if you can just tell us in the comments who you're representing today. And there goes our poll. I'm just going to we have 71% voted so far, so we'll be closing the poll shortly. Again, if you're just joining us, welcome. Great to have you here for our not our first opioid summit, but our first virtual opioid summit. I'm Kimberly Bjorn with Elevate Health. We have 81% voted. I'm going to give it just a few more minutes. I know people are coming in, and so they're getting settled. And we have just a little over a minute. We have 84% voted. I'm going to keep this open for just a little bit longer. And just for time's sake, like I said, we have a very packed agenda. So we are going to just review quickly the rules of engagement. As most of us have been on a lot of virtual meetings as of late, we want to make sure you're all unmuted just because of the background noise. So if you want to speak, you're going to have to unmute yourself. And again, the goal is to try to keep our background noise to a minimum. Please position your camera properly and check your camera. You can be on or off, but just know if it's on, we can see you. Limit distractions when possible. I will be doing the same. As you all know, when you host meetings, things happen in your life that sometimes are out of control, and we will do our best to minimize those. Avoid multitasking. This is going to be a long 3 hours for some of you, sitting and listening all the time, and I've been there. But when you are less distracted, you can really engage in the work. So avoid multitasking. Use the chat box for questions and comments. We will be having people checking on that regularly. Please be respectful for others' thoughts and ideas. You don't want to be offered the virtual door. And remember that this is a recorded event. And I'm going to hand this off to Elizabeth Allen, who's going to be introducing our executive leadership.
Thank you, Kim. Good morning, everyone. I'm Elizabeth Allen. I am the Behavioral Health Policy Coordinator for the Tacoma Pierce County Health Department. It is my honor this morning to introduce the Opioid Task Force Executive Leadership, Derek Young, who is council member with Pierce County, Dr. Anthony Chen, who is the director of the Tacoma Pierce County Health Department, and Connor McCarthy, who is a council member for the Tacoma City Council. So welcome everybody, and take it away, executive leadership. Derek?
Thank you, Elizabeth, and thank you to our steering committee who have kept the ball rolling in really difficult times. It was a little over a year ago that we last met as for a summit And I think I made a joke at the time because we were just beginning to see what looked like the now, now what we know as the COVID pandemic. And we had hired a new coordinator who's no longer with us, but and I said something along the lines of, you're joining us in the beginning of a pandemic. Good luck trying to figure out how to coordinate that. And I think all of you probably sense that we need a jump start. It's taken a lot out of not only our leaders, but our health leadership and folks that work in behavioral health scrambling to deal with the repercussions of all that's happened over the last year. So on the one hand, we need to take a breath and be proud of the work that has continued to happen, but we also know that the opioid epidemic and substance use disorders not only didn't go away, but unfortunately we may have lost some ground as well. So the good news is we have some tools on the way that was the purpose of all this in the beginning, is develop a strategy that Pierce County needs to combat this illness. And two of them are funding resources that we've never had access to. The first is that we have passed the behavioral health tax. There's one little extra hurdle we need to get through as a county council, but that will provide additional funding for access to treatment and other resources that are desperately needed, and all of our committees have already identified. And second, we are getting closer every day to settlement with the opioid manufacturers and distributors, and that will provide a new resource as well. So what I'm here to tell you today is that while the last year has been tough, there's light on the horizon, both for the pandemic and for opioids here in Pierce County. So I'm asking you basically to help us jumpstart things today. And here in a few months, when we're vaccinated, we can start meeting in person again. I'll look forward to seeing you all then. In the meantime, I want to thank again all the members of the steering committee who have kept things rolling, all of our committee chairs that have continued to meet as best they can, knowing how difficult this has all been. And then finally, my colleagues who have joined us here today. There's a number of elected officials who are here with us. I do want to acknowledge first a former elected official and one of my favorite people, former county council member Connie Ladenburg, who was with me when we first started this whole process years ago. And of course, city council member Connor McCarthy, my co-chair from the city of Tacoma, Judge Elizabeth Martin, who has been someone we lean on heavily throughout this from the judicial perspective, Mayor Julie Dorr from Puyallup, who has been with us from the beginning. And then I am really pleased to see that all 6 other members of my council will be joining us at some point today. Ryan Mello, Janny Hitchen, Amy Groover, Dave Morrell, Marty Campbell, and Hans Zeiger. So thanks to all of them who will be joining us. And I want to turn it over at this point to Dr. Chen.
Thank you, Councilmember Young. And thank you to everyone who has logged on today. As Councilmember Young said, for the 3rd straight year, we have filled the summit with dedicated, passionate people committed to ending the opioid crisis in Tacoma and Pierce County. Our summit looks very different this year. It is virtual, like many other meetings and conferences. And the COVID-19 pandemic has brought an unexpected shift in the way we work and engage with others. And we have to rethink how we provide services in our communities. Yet at the same time, you know that people are suffering more distress. We know that alcohol sales are up, marijuana sales are up, overdose deaths are up. We need programs and services that can help support our people and their families. More than ever, we need a path forward. We are challenged with looking for new ideas, creative ways to support those who need treatment, mental health services, and prevention. We need a comprehensive and coordinated behavioral health system here in our county, and I'm glad that our county leaders are moving towards that. There will be unconventional ways that we will need to work within the limits of the pandemic and open new perspectives and create innovative ways of thinking. Today's summit will challenge us to reimagine how we move this important work forward. Each one of us knows how the opioid epidemic affects our community, And unfortunately, many of us know how this affects people who are dear to us. Many of us see it every day at work. And certainly those many others also live through the tragedy much closer to home. Everyone has an important role to play to end the opioid crisis. We would not be here if you did not have hope that each of us can make a difference. Over the last 3 years, we've seen the challenges and have adjusted our work each time we needed to bring more stakeholders to the table. Your voices at the table is critical. Today, you'll be one of those stakeholders shaping the work of the task force. So thank you to every one of you for taking the time to be here. Together, we can end the opioid epidemic in Pierce County. Next, City Council Member Connor McCarthy will be speaking.
Thank you, Councilmember Young. Thank you, Dr. Chen. And I suppose I'd just invite everybody who's on this call right now. At City of Tacoma Council meetings, we like to do virtual rounds of applause. And so if you just indulge me, I'd love to give a virtual round of applause to Dr. Anthony Chen and the entire Tacoma Pierce County Health Department for all the work they've done to address the COVID pandemic. Sprung on us last year, and just being able to watch in the wings the work that he's done and his staff's done pretty much 24/7 has really positioned this community to, as Councilmember Young said, see the light at the end of the tunnel. So really grateful for your efforts, Dr. Chen. So, and despite all that work on the COVID pandemic, we're now back to the opioid crisis, and I will say there's a lot goes without saying that the COVID pandemic has really fueled the fire of the opioid crisis. The New York Times, I believe, has referred to the pandemic as a national relapse trigger, and it's also been referred to as the perfect storm for anyone facing a substance use disorder. And so, while all of us have dealt with the, wherever we're coming from, the real life struggles of social isolation, the impacts have really been that much more severe on folks, particularly in the recovery community, who need to be able to connect with their colleagues and mentors to help on the path of recovery. And particularly pronounced with those who may not be on the path of recovery yet, in really increasing the use to address the social impacts they're not otherwise able to receive resources on. So I don't have much more to add other than to say that, this whole task force began with the idea that if we got the right folks in the room and we worked together, we could come up with a coordinated strategy countywide, and we could improve lives. We could do things like increase the number of providers providing medically assisted treatment. We could do things like make sure that when people go to seek treatment, they could get treatment right away, and that there was the minimum barriers possible to receiving treatment, and that we could do things like work with our local school districts to help them support prevention and education programs. And so, to be perfectly honest with you, there's a lot that's been accomplished since we kicked this thing off, but there's a lot more work to do. And despite all the challenges of COVID that I mentioned, there's some positives. And I think you'll hear today about Senate Bill 5074, which is the Safe Station pilot program that just passed the Senate 49-0. And just as one example of that initiative is based on work that this task force did. So I see this task force as an effective tool for addressing the opioid crisis in our community, for driving down those numbers of folks who are dying from substance use disorder, and driving up those resources and that connectivity between those who have substance use disorder and medically assisted treatment and other treatments that get people on the path to recovery. So I want to, just as my colleague said, thank everyone for spending the time today And, just letting you all know that I'm extremely confident that the work we do here today and just having these conversations is actually going to move the needle and save lives in Tacoma and Pierce County. I know it has to date, and I know it will in the future, and that's why I'm here. So thank you so much for being here as well.
Thank you for those remarks. We're going to move on. We're actually a little ahead, which is great, to our keynote speaker, Linda Thompson. She's an executive director of the Greater Spokane Substance Abuse Council. Linda began her life work in substance abuse and violence prevention as a result of the August 1986 death of her 3-year-old son at the wheels of several time repeated impaired driver. A former banker, she turned personal tragedy into the public policy activism by helping to start the Spokane County DUI Victims Panel in 1992, and soon after became the executive director of the Greater Spokane Substance Abuse Council. A founding member of the Washington Association of Substance Abuse and Violence Prevention in 2000, Linda is a certified prevention professional with a Master's of Arts in Organizational Leadership from Gonzaga University. An advocate for community engagement and public policy, in November of 2017, Linda was elected to serve on the Spokane Valley City Council. Linda also serves as the Association of Washington Cities Board of Directors, as well as the National League of Cities Public Safety and Crime Prevention Committee. And we are so very thankful to have Linda come talk with us today.
Thank you, Kim. Just want to make sure everybody can hear me okay. Very good. I am honored to be here today. I was really taken back when Cheyenne called and said that Wanda Rochelle for Safe Streets had said, hey, you ought to give Linda Thompson a call. She might be a great speaker for the summit. As much as I'm honored to be here, it is with such a heavy heart that I do have the story I have to tell. And so if we could get the PowerPoint up that I sent.
Yes, ma'am. Cheyenne, we always have, we're all working behind the scenes here.
Oh, absolutely.
She will get that up for you very shortly.
Okay. So again, I work for the Greater Spokane Substance Abuse Council. I can tell you that this is not a job I ever thought I would have, but I am honored to be there. This is a perfect slide. And I'm not going to read all the slides to you, but I am going to read this one. What lies behind us and what lies before us are tiny matters to what lies within us. This is something that I didn't even realize as a young child, that I was being raised by 2 very young parents who really were reducing the risk factors around me and increasing the protective factors to help me grow up to be a drug-free kid, to make positive choices, to really be somebody who gave back. I was always active in school. I was a Girl Scout forever. And I was 5'9" in the 4th grade and often bullied because I was so tall, and thought, well, my mom, who was only 5 foot tall, kept telling me all the time, be strong. You're beautiful as a tall girl. You're going to be fine. And I think that those early days of helping me to be a good human being and to be compassionate for others is really what helped me get through the story I'm going to tell you. Next slide. In 1986, I was a single mom. I was a banker. I worked at Washington Mutual. I did mortgage lending and personal banking and car loans and sold annuities. Absolutely loved being a banker and thought that I would probably retire there. I was a single mom, as I said. I'd gone through a rough divorce and moved back to Spokane from the Vancouver area when Katie was just 3 and Trevor was a baby. At this time, I was very close to my own family, but also the kids as grandparents on their dad's side. And Grandpa and Grandma wanted to have them come down to spend a weekend at the center at their little farm before Katie went into first grade. And I was absolutely thrilled for the kids to get to go do that. And it was a little nerve-wracking because it was the first time that Trevor was going without me, but Katie was always a confident little girl and she loved Grandpa and Grandma and I loved them so much I wanted them to go. So they went down to visit for the weekend, and when they got there, they called me on that Friday night, and Katie was just beside herself because Grandpa and Grandma had given her a horse. Her name was Sugar. And Trevor told me, Mommy, it's true, chickens come out of eggs. He had seen eggs hatch and little chicks, and he told me he was going to come home as a chicken, and he was chirping at me on the phone. And I just remember how fun it was to talk to them. I told them how much I love them and that I would talk to them on Saturday night. On Saturday morning, I went up to Ponderay Lake with a man I'd been going out with for a short time, been my friend for a long time. And we were up at his sister's cabin about to go down to the water. And I looked up and my younger brother was standing in the doorway of the cabin. And I thought, well, now that's kind of weird. Why would Steve be here? Because his high school reunion at Central Valley was that weekend. And he was one of the people on the committee. But I didn't think more of it. I just yelled at him, hey, Beeve, get your suit on. The Hobie Cat's rigged. We get to go sailing. And as he walked over to me, I noticed that my brother, who was a firefighter at the time, he eventually became captain with Valley Fire. He was big and strong, and he didn't look right to me. And I noticed he was shaking. And when he got to me, he held my arms really tight. And I said, Steve. And through the tears on his face, he told me, Lynn, something bad has happened. Trevor's been killed. And I remember feeling like he had punched me as hard as he could in the stomach because I just started to vomit. And I ran into the bathroom and I kept throwing up. And finally I was able to ask my sister-in-law, who was on the floor wiping my face. I said, what about Katie? And she said, we don't have any details, but we know for sure that Katie is okay. With that, I stood up, vomiting stopped. I ran out the door and I said, Rich, get in the car. We have to go get Katie now. We drove back to Spokane. We didn't have cell phones at the time. I kept calling every phone booth we saw. I'd call my grandpa and grandma and say, hey, what happened? Where do I need to go? And there was never any answer. When I got to my house, my best friend was there. Steve knew that Louise would help me, and she did. She helped me get dressed. She helped me pack a bag. And I just kept saying, I don't believe he's dead. I would feel it in my heart if my little one was gone. But we flew to Portland, drove over to the only hospital I could remember when I lived there, and that's where Katie was. And that's where we saw the newspaper the next day. Next slide, please. And I think hit twice again. This is the headline of the Vancouver Columbian on August 17th, the day after the crash happened. If you'll hit one more time, please. There we go. The headline says, 2 die when car hits horse cart. And it shows the little dead pony, Camise. She has a straw hat on. To the right, it shows the little cart she was pulling. And to the left is the chalk outline of Trevor's body on the highway. On the second page was the man that caused this crash. And when I saw the word accident and I got the details of what had happened, I said, I will make it my life work that we never talk about an crash as an accident. This was prevented, could have been prevented in so many ways and so many times. What had happened that morning was my children were going to be in the La Center Days Festival Parade. And at 9:15 that morning, they came down onto the road heading into the center. It was Grandpa driving the pony cart, being pulled by Camise with Trevor beside him. Behind them was Katie on her horse, Sugar, and behind Katie was April Brewer. She was 23 years old. She was severely learning disabled, and she was on a 3-wheeled trike because she wanted to be in the parade with Katie. Just a few minutes after they got onto the road, this man came down the road, having been served long after the bar should have been closed. And then he had stopped and bought beer at a convenience store as he came home because he lived at the end of the straight stretch before you go into the center. He went into the ditch 200 yards before he got to them. He came up, he hit April Brewer. She and her bike were thrown so far that nobody even knew she had been there. until my little 6-year-old said, "You have to go look for April. She was behind me." Then the car came up and it hit Katie's horse, severing the back leg off of Sugar, which is what saved Katie's life. And she bucked her off over a fence into a field of hay that was long, and that's what saved Katie. But the car came up one more time. It hit Trevor's side of the pony cart. Dad said he looked over, he saw his little head snap forward and back, and he was thrown to the highway, as was Grandpa, and the car ran over Camise, killing the little pony, and ended up perpendicular in the ditch. Katie come up over the fence and she told me that she saw the man pouring out the beer and he yelled at her, but she went over and tried to wake up Trevor. She told me that he had dirt on his face. She couldn't wake him up. She couldn't wake up Grandpa. And thank goodness a woman came and held on to her until help came. And help came really quickly. They brought ambulances for Grandpa and Katie, and they took Trevor by helicopter to Emmanuel Hospital in Portland. They worked valiantly to save him, but they couldn't. Which for me as a mom, knowing there wasn't anything I could have done, was some relief that he died very quickly. An hour and a half after this crash, this man blew a .27 BAC, and he had had 17 previous DUI arrests with no convictions. Now, Mothers Against Drunk Driving had just started in 1980, and I had joined that because I wanted to make a change for some of the people I knew that drove impaired. This man was charged with 2 counts of vehicular homicide and 1 of vehicular assault. And he actually pled not guilty, saying that April Brewer, because she was disabled, had pulled out and caused the crash. We had to get attorneys for our family. We had to make arrangements to have Trevor's body taken back before I could take Katie back home to Spokane. And that started my journey of focusing on my children, focusing on the changes I could make. Next slide. There were things like when I had to go and plan his funeral, the funeral director at the cemetery where my grandpa and grandma had given me the plot next to them to have Trevor buried there. So when they died, they would be with him. The man there told me that if I didn't buy the mahogany casket and the brass hinges and erect a statue to my child, that no one would know if I really loved him. And I thought, how could you say that to a parent at the most tragic of times? Next slide. There were bills that came through, and you can see this word assigned. Next slide. Because he had so many DUIs, he had $50,000 worth of forced place insurance, and the hospital had to make sure they were paid. So they put a lien on my house. Luckily, Safeco Auto Insurance paid my kids' claims, and because they were considered pedestrians. And so my insurance paid and got that lien lifted. Again, traumatizing a family that was trying to deal with the loss of life for their little one and the injuries so severe for the grandpa and for Katie as well. Next slide. On Trevor's 4th birthday, his death certificate came in the mail. No parent should ever get a death certificate on their child, and certainly not on their birthday. And I just kept looking at things and gathering all the paperwork and thinking, I have to do this for him, and I have to honor Katie with being strong and gathering what I can do to make change. And I kept seeing everywhere through all this process how I could make change and I could help other families. Next slide. It finally came to, in January, it finally came to the trial, and he was found guilty of 2 counts of vehicular homicide and 1 of vehicular assault. And he was sentenced to 27 months and going to serve 13 months. It really didn't matter to me how much time he was going to serve. What I couldn't figure out is how someone had 17 DUI arrests and never get any treatment or help with the addiction of alcohol. And there was a woman in the courtroom who told our family at sentencing, we knew he was going to kill someone sooner or later. Sorry about that it was your family. And I thought, what am I going to do? How am I going to use my power for positive change? And so I started going to the state legislature as soon as the trial was over and talking about treatment and talking about recovery and saying, we cannot just lock up people and punish people out of this behavior. We've got to figure out a way to bring community together, to give a voice to those who are in recovery, that they can help us get others into treatment, that we can all be an advocate for treatment, and not place blame or say, well, he's addicted to that, or, you know, it's pull themselves up by the bootstrap. I just felt that somehow we had to change how we talked about this. And there were many advocates for treatment and recovery working on this issue, of course, long before I got involved. But I just felt that I had to really do that. And so I started speaking out anywhere, prisons and schools and rotaries and everywhere I could think of. And I wasn't sure how we were going to survive. So I want to tell you the resiliency of this story. I got married shortly after this crash, which was a miracle in itself because my husband was very, very brave to take me on. 50% of couples who are together break up because of the loss of a child. I'm sure there are people on this conference who have lost someone or known someone. It just changes who you are. And so Rich took me on, and I'd had a lot of trouble having my first 2 children. Next slide. But this is our son, Nate. And I got pregnant right after we got married. And Nate was born on Trevor's 5th birthday, 2 hours later in the day than when I had Trev. And I can tell you that I knew Trevor was in him right away. When I potty trained the boys, they both sang. Katie never sang, but they did. They said the word girls the same, boys and gulls. So people will say this is an old story, and it is. I was 33 years old when Trevor was killed, and I'm 67. More than half of my life has been spent in prevention. And I see people on this call like Terry Schmidt Whalen and Safe Streets community organizers, people that I've worked with that have helped along the way. But the resiliency of what happened was when we had Nate, he really saved us. So next slide. So this is my daughter, obviously on her wedding day, and she met her college sweetheart, Jack, at WSU, that got married 7 years later. And we missed Trevor at the wedding. You can see where he should be standing on the side there. But Katie and Jack wanted to have children right away, and she suffered 5 miscarriages. They were able to fix what happened, and then her husband got deployed to Afghanistan. Next slide. And this is little Jaylee June Claros when her daddy is returning at 8 weeks old. He was there for the birth that had to go home, or had to go back to Afghanistan before he was able to come home when she was 8 weeks old. But I was holding the baby. Katie was with me, and she just said, Mom, and she started to sob all those years later. And I said, Katie, you're okay. The baby's okay. We have to pray for Jack in the unit. And she said, Trevor died, Mom. He died. And I said, he did. And she says, I don't know how you survived, because I would simply die if something happened to Jaylee. And next slide. I told her it was because of her. I said, you were saved for a reason, and we will honor Trevor. And that is how I got into work in prevention. Next slide. And my main goal was, first of all, to use crash record collision. It is no accident when drive impaired. And we are seeing an incredible number of crashes, including fatalities, that are with opioids and prescription drugs and a mix of marijuana and alcohol. And it is no accident. We can all use the words that will make a change, and to say it's no accident, and we can prevent that. Next slide. So the prevention part of this, that my message is that first, do no harm to yourself or others. When you think about someone who is struggling, think of them with kindness. Think of how you can be supportive. It is harmful when we put people into categories of, I would never call anyone an addict, but those who are in recovery will talk about, you know, I am an addict and this is how I got into recovery. Do no harm to others in the way that we talk about or to them, as we look at their perspective, to try to understand that this is opioid addiction, alcoholism, any addictive behavior. I mean, the violence, it is about all of us. We have to come together and do no harm to others. Be a compassionate human being. Understand, learn the facts about addiction, learn the facts about poverty, about systematic racism, about the racial disproportionality in our juvenile system and our justice system. And look at how you can be someone of compassion and speak up for others. Use your gifts to make a positive impact. We just heard from elected officials in your community and Dr. Chin. And think about how Councilmember Young was talking about bringing in resources, and Councilmember McCarthy seems very approachable. Be positive, connect with your elected officials. You have incredible legislators from your area, with Senator Conway and the Speaker and others who have been there at our state legislature making great impacts. And connect with our congressional delegation. You know, Senators Murray and Cantwell are leaders in our national congressional work, and they are very open to hearing from you. Use your gifts. If you're a speaker, if you're a fundraiser, if you're someone who can advocate for treatment, if there's someone who can reach out and share a phone number or a resource, do that. And let others know how you feel now. One of the things I really appreciated about the opening remarks and about how everyone was getting onto this call was people were kind to one another. Tell the people you care about now. You know, I have very dear friends that I sometimes don't take enough time to tell them how much I care about them and the gifts that they bring to my life. Even the folks that teach me lessons. Like I remember one time testifying in front of the Senate, and I was telling the story of losing Trevor, and the senator in the chair said, "Is there a point to this?" And I said, yes. In 1986, there were 503 children aged 5 and under who were killed in impaired driving crashes. You can help pass this bill that will help us get a felony DUI law in our state, and we will save lives. And I really appreciate that you care enough for me to get me to the point. Next slide. So this is a philosophy I just recently saw. I have all kinds of things in my office about be bold and mighty forces will come. Your time is coming. Life has no remote. Get up and change it yourself. But this is from an incredible man that we recently lost, U.S. Congressman John Lewis. And I will read this one. My philosophy is simple. When you see something that is not fair, not right, not just, then you have a moral obligation to say something, to do something, stand up, speak out. Be optimistic, don't get lost in a sea of despair, but be bold, be courageous, and all will work out. I think this really is the philosophy of prevention, treatment, and recovery coming together. We have an obligation to those who are suffering from the addiction of opioids and other drugs and alcohol in our community. We can stand up, speak out. Every voice can come to the table and help us. You have an incredible agenda today of experts who are going to share in just great resources and opportunities for you to get involved and to do this work. Everybody has to help, because we never know when one of us is going to be affected by a crash, by an overdose, by something that is going to change your life. And let's prevent the tragedies from happening and support those who need our help. Next slide. So this is my contact information. Please get in touch anytime. I've got my cell phone on there. I'm a night person. You can call me up until 11 o'clock at night. Don't call me before 8 o'clock in the morning. I'm not a morning person. But GSAC, Greater Spokane Substance Abuse Council, I work with incredible volunteers, and Amanda Duggar, who's our community outreach person, is somebody who could help as well. Please contact us, and I'm open to taking any questions.
Thank you so much, Linda. If there are any questions, we're going to ask people to put them in our chat box, and I'll be monitoring that throughout our summit today, not only for Linda's presentation, but for any of the other presentations. If you do have any questions or comments, feel free to put them in the chat box. But we want to just thank you, Linda, so much. Again, you know, being virtual, it's hard to hear all those virtual congratulations and thank you. Thank you so much for being here today. But your work is wonderful. So we all virtually applaud you. I love that quote about being courageous and bold and being optimistic during, you know, in a sea of despair. I think that's just perfect, especially for right now, trying to deal with everything during the pandemic. So this leads us to a 5-minute break. We will break and come back at 9:45, everybody. So thank you very much.
All right, everybody, we're coming back from break. We had about 79% voted on our poll question. And out of the group, limited resources to address the epidemic was the highest score of 36%. Second in place was stigma that impacts people's desire to seek help. So at this point, I'm going to end this poll. And we're going to move on to our next speaker. So, Joan Bouquet is the youth program manager at Safe Streets in Tacoma. And we have Tamara Gabuaro. Please forgive me if I did not say your last name correctly, Tamara. And Nia Schultz, senior at Stadium High School. Tamara's a freshman at the Science and Math Institute. And please, again, Nia, if I said your name incorrectly, please state your name correctly when you speak. Taylor's the executive director. Oh, excuse me, I'm sorry. So Joan, I'm just excited for you to be here, and I'm gonna let you take it away. And Cheyenne, if you have screen, that'd be great.
All right, thank you, Kimberly, and thank you everyone for being here. Thank you for giving us the opportunity to speak today. My name is Joanne Bouquet. I am the program manager for Youth Leading Change. We're a youth-led program in Pierce County, and we serve middle and high school age students. And so if we could go to the next slide here. One more. Thank you. And so in preparation for this, a lot of the work we do in our program is obviously around youth, but it's around empowering youth and supporting them, and also giving them the chance and different opportunities and resources to become community leaders. And in preparing for this, we had a discussion. We were like, how has quarantine made you feel? What are some things what are some emotions, some feelings, some thoughts that you've had during quarantine? And if you look at the slide, we've just sort of created a word cloud that shows and represents some of the things that were said. It was refreshing at first. They're exhausted, in a cage, dream, hope. I would say it's overwhelmingly negative. There are some positive terms there, but one of the things that we wanted to make sure was that our youth are always able to have a voice, have a platform, to be encouraged to do so, to be empowered to do work in their community, and to support each other. And as a youth worker, I find ways to support my youth. And so looking at those words, I'm sure a lot of us can connect and find a word that really speaks to how we're feeling, perhaps even in this moment, because many things ended with quarantine. But as a youth program, we couldn't let this stop our community work. If we can go to the next slide, please. And so in that, we had to create a virtual reality. We had to transform our traditional after-school program into a virtual program. We moved to Teams, we used Zoom, Discord, GroupMe, email, text, just any way we could build a connection, because that was the biggest and most important thing for us. It wasn't necessarily to make sure they were learning something or teaching something. It was just about building that relationship, maintaining that relationship, knowing that me as a youth worker, I'm here to support you. I'm here for someone to talk to lean on, to be a mentor for, and we can connect and learn from each other. All of that, if that connection isn't there, the rest of that will follow if that connection is there. And so if we can go to the next slide. And so we had to adapt and reimagine our reality as well, because it has changed. And so that image there is a picture of a student and one of our staff, and we hosted a Halloween drive-through. And so traditionally you're able to trick or treat, go door to door. but we thought what would be a safe, socially distant activity for us to do, and that was just to have a drive-through. A lot of people came out, they brought their children, they decorated their cars, they were in costume, and we were able to get a couple messages out there to hand out opioid awareness flyers, to hand out program flyers, to hand out flyers around the flu vaccine, because that was going out during that time as well. And so just looking at different things in our community, and finding out different ways to adapt and create and reimagine what's next. And so I'm going to pass it over to our two youth speakers today. One of them is, first one here is Tamara. She's going to be just sharing her story about how she herself experienced quarantine. And I hope you can connect with her and get something out of that today.
Hello everyone, my name is Tamara Bawaro. Hello everyone, my name is Tamara Bawaro, and I'm a freshman at Science and Math Institute. Online school is a new thing to me. I've been overwhelmed with the amount of work that has been given to me every class period, and being put with the pressure to have to complete it, have to do my best and get good grades, all in this period of time with COVID and being by myself. The lack of human interaction has definitely had its consequences, especially even though I have an introverted personality, but I try to make it work. With the amount of breakdowns I had in my closet, crying, screaming with the frustration of everything. But with all this has come its positives, like having new hobbies and interests. Next slide, please. Like I learned how to draw, I bettered my art skills. I've learned a new language, Korean, like how to say hello, 안녕하세요, and thank you, 감사합니다, and other things too. I met new friends online through Discord, social media. They've taught me things and helped me fight this battle. So with this, I urge you and others to find the light in the darkness. Is there any new skills you want to learn, new people you want to meet, messages you want to spread through the world? Do it. Because when life gives you lemons, you make lemonade. Thank you.
Good afternoon, everybody. My name is Nia Schultz. I just came here to tell you guys about, how quarantine has been for me. I'm a senior at Stadium High School. Senior year has been a little rough. Especially starting out, we didn't know, how they were going to do everything for us, how graduation was going to go, how college was going to look. And it was a very stressful time. The lack of motivation has been very prevalent in me and other students when it comes to doing our work. We're kind of just sitting there at home all day. There's been days where I wouldn't even see the sun for 5 days. I'd be sitting there inside 5 days straight, can't go out because my parents, we have high risk families that live around us. My grandparents are high risk and we live with them, so we can't really go outside all the time. And it was a lot of strain, really stressful. And honestly, it took a long time before we got used to it. And even now, there's still some students in my classes that I can say are definitely still struggling with this and the quarantine. And, it takes a lot of effort to find out how to cope with it. I know your mind tends to wander, and when your mind goes and starts wandering, you start, thinking of the worst situations and scenarios. And it can be very taxing on you. And recently, I've been finding different ways to keep my mind going. I've gotten to whittling, drawing, reading. I'm pretty sure I've read every book in my house at this point. And it's really hard, but when you go and you focus on the little things, finding the good in every situation, it can really help a lot. and having people who support you, like with Safe Streets. Like I kind of like look forward every day to like talking to a bunch of people and ranting after school to all these people about all this crazy stuff that's going on. And so, you know, keeping a bunch of friends, family, you know, around you and speaking to them about the struggles you're going through, being able to relate to all these people, it really helps. And I really like telling a bunch of other students and just people in general in my community about like just do something that you're interested in or even like you're curious about, because it can really help. It can really help you with your mental, emotional health. And you know, when you're constantly learning, constantly thinking, it really helps you get your mind off of the fact that you can't really meet other people or go outside. And so I thank you guys for having me here and listening to my story. But like I said, it really helps to be active in any way you can. Like I went and helped all the homeless people eat food, like get their food, help them cooked at the Tacoma Rescue Mission, like stuff like that. It can really help you in so many ways, and it makes you just feel a lot better about yourself. So I thank you guys once again, and please have a nice day.
Thank you, ladies. Next slide, please. And so today, there are many people in this room from different industries, and I'm hoping we can find some space today and use this opportunity to collaborate. If we can't find ways to work together, we'll never find success in projects or grants or even in our legislature. So just taking that time today to connect, taking that time to collaborate, because it's about our community. Right? The operative word in community is unity. So we do have to come together, find those common things, and only through that will we be able to have our success. Next slide. And finally, it takes a lot of energy to do this work. Community work can be exhausting, I'm going to be very frank. And we always have to constantly tell ourselves and constantly look towards a positive, constantly remind ourselves of the importance. Maintain that hope, and just continue to invigorate ourselves. And in that, I hope that we can invigorate each other in a time of loneliness and isolation. We are in a tech world. We're able to connect in ways and with people that we normally wouldn't have. It's very easy to create a Zoom meeting or have that connection, do a phone call. So doing what you can in your part, checking in on each other, showing your appreciation, showing grace, showing love for each other, and being kind to each other ultimately. Next slide. And so that just ends our presentation today. If you are willing to reach out, I'll put my contact information in the chat. And just going to end with this quote: after the storm, there is sunshine. So I hope everyone has a good day. Thank you very much.
Thank you so much. That was wonderful. I hope you all can see the chat comments. I want definitely Nia and Joan and Tamara to look at the comments, because people were really motivated and excited to see what you were saying and sharing. So any questions for our speakers before we go to our next speaker? Well, without further ado, except that, you know, I'm in charge right now. I'm trying to figure out, hold on. Oh, the things that can go wrong when you're not expecting it to go wrong. Hold on. There we are. I found my screen. So Taylor Woodruff is our next speaker. He is the executive director of Alchemy Skateboarding. Taylor is a 2012 graduate of the University of Puget Sound, where he received his bachelor's degree in studio art, receiving credit for Art 495, Skate Able Art, where he built modular skate furniture for school credit. I gotta look at that, it's pretty cool. Originally from Southern California, Taylor has an extensive background in skateboarding and looking foolish, which he uses daily while teaching skate camps, clinics, and other school programs. Participating in the original Go Skate Tacoma 2011 event sparked interest in advocacy and change making related to skateboarding, and Taylor has been with the organization since its inception and formal incorporation in 2014. Serving as the program director for several years before becoming the executive director in 2018, Taylor also co-founded the Grit City Grindhouse retail skate shop in 2013. That has since become a part of his alchemy and is used as a training program for youth working on employment readiness skills. Thank you, Taylor. And Cheyenne, you want to go ahead?
Taylor actually doesn't have any slides, so it's just
well,
him.
there, go for it, Taylor.
All right. Sorry, everyone. It is just my face talking with you guys today. But again, I'm here in our skate shop, so at least we have a nice background. And thank you for the introduction. Again, my name is Taylor Woodruff, and I'm the executive director here at Alchemy Skateboarding. I'm really grateful for the opportunity to speak here today, and honestly, a little bit intimidated. As you heard from my bio, I am not formally trained in substance abuse work, social work. I'm a studio artist who plays a lot. And so this might be a natural fit for some of you folks in the room, and it might be a little bit strange, but the focus of my talk today is two of the most important aspects of my work, which is fun and play. My job over the past 7 to 10 years has been to study the effects of play on people. At least in my mind, I like to think I'm a researcher with a very large data pool. But in reality, I sell skateboards and skateboard accessories and teach skateboard classes to individuals, groups, students, adults, court-connected youth, and really anyone wanting to learn. We've done skateboarding from youth as young as 2 years old to youth that are 56 years old. So if there are any folks out there over 60 that would like to do a skateboard lesson, let me know. I'm always interested in expanding that range. Over the course of those years doing this work, it's really afforded me a vantage point to observe and interact and learn from so many different people. And the most fundamental thing that I've come to learn from this is how important fun is, and how well we can achieve fun through play. I do want to mention sort of a classic cliche I'm sure everyone has heard, the ounce of prevention being worth a pound of the cure. That's really a lot of our focus here at Alchemy, is working with young people and providing them different things they can become passionate about, different skills, different opportunities to play that they can sort of find what matters to them and pursue it. That being said, we know there's limitations to fun. Obviously, if you're experiencing housing insecurity or lack of food, you can't eat and live in fun. And so it's important that fun is not a cure-all. People need to have their basic needs met. But once those needs are met, people struggling with recovery or whatever things that are going on, we have found that play and fun are really valuable to continue in that process. I've had the opportunity to work with a lot of skaters in recovery over the years, and I've heard it firsthand how much having an activity to engage with helps them stay focused, stay motivated, and even at times disconnect with things. I've heard it over and over again that skateboarding is a form of meditation for people. It's a way to look inward, but also, again, it's a release. It's a way to have fun. One of the things that's been interesting to me about studying fun and studying play is I take for granted how valuable those things are. But a lot of times, and in a lot of cultures, fun isn't necessarily valued for what it actually is. And what I've learned over the years is that fun is not a lack of work or effort. It is not frivolous. It's actually an incredible structure to learn how to work, to learn how to grow, to build relationships with other fun seekers. And I think it's really important to mention that the point of fun is not to learn how to work. It's not to grow, but that those are natural side effects of good fun. When we are engaged in play, our mind is actually releasing dopamine. It's rewarding us for doing these fun things. And it actually makes it easier for us to remember things, to learn things, to forge connections. And so on an academic and educational level, fun is hugely important to student success, or the success of anybody. I think that this does relate to all people, but being a youth nonprofit, it's extra important to youth because we know that young people are more vulnerable to outside influences because young people are in this process of developing their identities, deciding who they are, who they want to be. We serve a lot of people that we say are at risk of being labeled at risk. Once you have that label, it's sort of a track where young people lose this ability to define themselves or pursue these opportunities to prove who they are, what their values are. And that sort of theft of this identity opportunity happens a lot. And once it's started, it's a lot harder to reverse, a lot like a bad habit. But we know that fun can be a really powerful tool to reroute and recreate these opportunities to identify and define ourselves and our values and these plans for the future. So that being said, I want to just mention a little bit of what Alchemy does. In a tangible space, we run a small indoor skate park that currently with COVID is open to the public through appointment only because we're limited to 4 people or less. But in a non-COVID world, we've offered high school credited skate classes, internships, community building through public events or advocacy opportunities to get involved with parks departments and advocate for skateboarding opportunities, active transportation opportunities. And one of the best things I think we've done over the years is our skateboard camps. My favorite thing about teaching skateboarding is not as much seeing young people learn these skills, but rather using high school aged youth as instructors. It was absolutely amazing to me to see 15-year-olds step up as instructors and the different way that they carried themselves after a camp, after seeing 8 and 10-year-olds looking up to them, asking them for advice, realizing that this skateboarding game that they play has so much value outside of the fun it brings them, but that it's something transferable, something that can be shared, and a bridge that it can make between people. So that, along with a bunch of these other programs, have really solidified in my mind how important fun and play are. I want to touch for just a second on skateboarding itself. I live in my own little skateboarding bubble where I know that skateboarding is valuable and fun. And I know that the rest of the world doesn't necessarily share that perspective. And so I think some of the most important things that skateboarding has taught me and values that we try to teach in our programs are, number one, your work ethic begets good work, improved outcomes, and eventually easier work. This is so true with skateboarding, with learning a trick, the amount of dedication it takes, risking physical harm to do these things. The better you learn at working, the better your work becomes and the easier it is to work hard. And that's something playing with a toy has taught me. I've also learned that you can learn from everyone around you and the importance of a growth mindset. It doesn't matter if they are more skilled than you are at skateboarding, everyone has something to teach, and everyone can learn if we approach things that way. On the other side of that, I've learned to just share what you know with anybody. If someone has a question and there's something you know about, it's such a great way to share and build a connection. One of my favorite things skateboarding has taught me is that failure is not an option, it's a requirement. To learn to do any of this stuff, we have to fall, we have to learn to get back up, we have to analyze what went wrong, we have to move forward. Part of falling and getting hurt is the other thing I've learned is taking risks, not just foolishly jumping something you have no ability to do, but learning to weigh potential outcomes. Risk management, right, is something that most skateboarders understand intuitively. I've learned to always pursue balance. Obviously, in the course of skateboarding, physical balance is important, but also the balance between all things in life, our work and our play, our successes and failures. We really need both to grow. Confidence versus arrogance. I've never landed a trick being arrogant, but if we're not confident in the things we pursue, it's also hard to succeed. And then also the balance between learning and teaching, again, that growth mindset. And then the last thing, the most important thing that I've learned is that fun is simply important. It is, as I've mentioned, a tool for learning, for growth, for community building, for all these things, and also to relieve stress, to vent. So many things can happen out of fun. And so I have sort of a little story to wrap up that I learned from Alchemy's founder, and my friend Ben often tells this story, and it's about a polar bear and a dog. And so I've done some research on the story, and for the sake of this presentation, I'm going to tell it a little bit more as a parable than the exact facts. But the story is, in the Alaskan wilderness, there was a man who lived with his team of sled dogs that he would keep tied up at night. And this specific parcel was known to have polar bears frequently rolling through. And so one night when one of his sled dogs was tied up and outside, the sled dog owner saw polar bears approaching and knew that he couldn't do anything but watch. As the polar bear approached the dog had two options. It could growl and bare its teeth and be defensive and create conflict, or what the dog ended up doing was jumping down on its front legs, tail wagging in the air, and smiling at the polar bear. The polar bear then proceeded to play with this dog. There's footage of polar bears petting dogs on the internet. And the polar bear came back night after night and actually spent time playing with this dog because they forged a connection and realized they weren't enemies. They had stuff to contribute to each other, and through fun had a relationship. And the moral of the story that I really value in our work here at Alchemy and with everything is that the invitation to play, if communicated properly, is irrefusable. We know now, because of technology improvements and cameras, the amount of wildlife photography and videos of animals even having fun. Fun is not a human only activity. There's literally footage of birds sledding on leaves, picking the leaf up, running up the roof and sledding again, for no other reason than to have fun. It didn't secure food. It didn't secure a mate. There was no biological imperative, but animals and people alike have a predisposition to have fun, to explore, to engage in the world in that way. And so that is sort of the wrap up of my oddball presentation on playing and fun. And I think I've lost track of time, but if there is some time, if people have any questions, I'm happy to stick around and field any of those questions.
Thank you so much, Taylor and Joanne and the youth from Safe Streets. Those were wonderful presentations, and hopefully you're feeling inspired. Again, this summit was all about thinking outside that box, thinking about what can we do? How can we be motivated in this pandemic? And what can we look at in terms of moving work forward with that resiliency lens of this is a new day and being creative in what we do. So thank you so much. We're going to take another break here.
Elizabeth, let me interrupt you really quickly. I see Marty Campbell's hands up.
Oh, thank you. Yes.
If I could ask a question of Mr. Woodruff. Taylor, and you and I, thank you for all your work you do in the community. It means a lot to a lot of youth. And you and I were having a conversation the other day, and it's caused me to reflect on it. I think we're coming up on the 10-year anniversary of when we decriminalized skateboarding in Tacoma. It used to be a crime just to ride a skateboard in the streets of Tacoma. And I want you, for someone who's been engaged in that community, how has that changed the way that people see skateboarders, interact with skateboarders, and how skateboarders interact in our community by simply decriminalizing it?
That's a great question, Marty, and apologies to everyone if I go on a 30-minute rant. Someone will have to stop me. Yeah, the power of belonging is so important, and it's something, to Marty's point, that we've been able to study the difference of welcoming a group of people and encouraging them to do something that's important to them has been tremendous. We joke all the time that every school in America has a basketball court, a football field, a soccer field, and a no skateboarding sign. And so this contributes to a social stigma around what this activity is, and it seeks to define a population that is actively trying to define themselves and pursue something valuable. And so the act of decriminalizing, the act of welcoming a group of people that are maybe different, has been huge. It's created so many opportunities for young people to be invested in, to see themselves in a positive light, and to get involved in the work we do and give back. And so, yeah, 10 years after our first event, I think that Tacoma has become such a more welcoming place for that community. And because of that, that community has really blossomed. And we've seen a lot of success with high schoolers going on to pursue amazing things, whether it's at college or at other organizations. If that's sort of the shortest answer I can give, but it's tremendously important to value people for where they're at and provide them opportunities to play and do the things that matter.
Thank you.
Thank you so much. Were there any other questions or comments, either for Taylor or Joanne this morning? I'm seeing a lot on the chat for both, for all of our speakers, actually. Thank you so much, and appreciate you sharing your talents. Well, if there aren't any other questions at this time, we're going to take another short break, around 5 minutes. So we'll resume around 10, we'll just make it 10:30. How's that? We'll just make it 10:30 on the dot here to come back this morning. And in the meantime, with your break, check out our next poll. So thank you.
Hi, everybody. We'll get back. I am omitting a few people. Oh, my screen just did something really weird. Oh, it's fun being me sometimes. Hold on, folks, as I figure out. Again, I'm having a challenge. Hold on for a second. Slight technical difficulties, folks. I'll be up in a second. Okay, sorry about that, everybody. My computer wanted to do many different things. I apologize for the delay here. So now is our subcommittees, and we have several to talk about. Our first one is access to treatment, and our co-chairs are Dr. Paul Lukowski from the Tacoma Needle Exchange and Dr. Anthony Chen from the Tacoma Pierce County Health Department, and they will give us some discussion about access to treatment. Thank you, Dr. Chen.
Great, thank you, Kim. So treatment is a key strategy for those suffering opioid use disorder, and what this committee focus on, the Access to Treatment Committee, is focusing on how we can make sure those suffering opioid use disorder can get treatment, and to make sure more providers are providing treatment. Some of you may be aware of some of the higher profile impacts we've had, such as the collaboration between the health department, the Tacoma Needle Exchange and University of Washington on the Meds First program, which is a low-barrier buprenorphine, where people can literally walk up and get into treatment. But there's much more that's been going on behind the scenes. Some of the shifts in our Access to Treatment Committee in the past year is that we have moved to subcommittee work, and you will hear shortly from two of them. We are also planning to shift more towards the main committee addressing policies and systems that might be barriers for some of this work moving forward. And so right now, today you will hear from one of the very active subcommittees, the MAT, or Medication Assisted Treatment Integration Work Group, which is working on the nitty-gritties of implementation for providers and their offices, everything from what's the paperwork or the processes that you do. Then you will hear from a joint transportation subcommittee with the Right Services and Right Time Committee, because people can't get to treatment if they don't have a way to get there. Just to let you know, we're also working on a telemedicine subcommittee, which, certainly in the pandemic, this is a very timely thing for us to be talking about, how people can get to services without physically getting there. And then we're also going to be looking at how the hub and spoke system is working and how to make that better. So with that, I'm going to turn it over to Charnay Ducrest, who will talk about the Transportation Committee, and then later we will hear from Melissa Haney about the Medication Assisted Treatment Integration Work Group. Charnay?
Thank you, Dr. Chen. Hello, everybody. As Dr. Chen said, my name is Charnay Ducrest, and I am the co-chair for the Transportation Committee, which Dr. Chen, like Dr. Chen said, is a joint Right Services, Right Time, and Access to Treatment Committee venture. So do we have some slides? Oh, I just couldn't see them because of how this was put together. So there they are. So just a little bit of background about myself. I am a person in recovery from opioid use disorder. I celebrated 6 years last month, and the health department has played an integral role in that. I was a patient with in the methadone clinic for about 3 years. And throughout that time, I had a little boy. And I just started kind of helping patients get connected to resources, just as a kind of thing to help people with, because I had accessed a lot of resources myself, getting into and then sustaining recovery. And so I was able to join the health department as an employee as a recovery coach. And so I was able to get recovery coach training. I am a certified peer counselor, and I'm also a community health worker. And I get to do things like this transportation committee. And so this committee kind of came out of the idea that in access to treatment and in right services, right time, transportation continued to come up. So like Dr. Chen said, if you can't get to treatment, it isn't going to help. So this group was put together, and I am grateful that I get to help see where this is going to go. So next slide, please. So I kind of told you about where the subcommittee originated, but what we did at the very beginning was that we started with the strategic prevention framework. And so we all could agree that there are transportation problems in Pierce County. And so we took a really deep dive into that. We wanted to know, like, what transportation is there? So we took some time to look at what is available, and we wanted to look at Pierce County as a whole and focus on the Medicaid population, specifically those seeking access to behavioral health. And that kind of came out of this strategic prevention framework. We worked on some questions like the barriers that contribute to people not being able to access services in Pierce County. And so some of the things that we came up with were location. If you are out in a more rural area of Pierce County, you may not be able to get onto a bus, or you may not be eligible for paratransit for whatever reason. For instance, people on Medicare do not have a paratransit benefit along with their Medicare insurance, and so they're not eligible for paratransit. Age was also a factor. When we were looking at all of these things in Pierce County that were affecting transportation, we looked at some aging and disability resource information that they had gotten some survey numbers and information that shared that one of the biggest problems was people didn't know what services were available, and they didn't know how to access those services. And with so many things online, for instance, you can put together a whole entire bus trip online, but if you don't know how to get online and do that, then you can't really put that whole trip together. We also went in and looked at like the subgroups that were really affected by the transportation in Pierce County, or the lack of transport, or the different barriers with transportation in Pierce County. So we talked about like women with children, or even men, moms and dads with children. Getting on a bus is not super easy with kids. They've changed it. So when I was riding the bus, you had to take your child out of the stroller. But now, no, you had to leave your child in. Either way, it has changed. So like having to manage a baby and another kid, and then whatever else you need to bring, that can be a really big barrier for accessing services. Again, rural areas is a subgroup that's really affected because there is very little service. And if you can get some sort of ride, it's, a Lyft or an Uber, and those are not the cheapest things in the world. And so from there, we just kind of wanted to figure out, all right, so we're seeing that this problem is existing. We're getting a little bit of data that shows that this is a problem. Can we go to the next slide, please? And we knew that we wanted to do something to help. And so we had a change in the task force leadership. And so I am the only co-chair. Part of what we would really like to do today is find another co-chair. And so we just kind of wanted to regroup. So those of us that had hung around, we started to try and invite additional agencies and people. And so we also had some other people with lived experience come and share their experience with transportation and getting into recovery. They used to ride the bus from somewhere right at the King County, Pierce County line. And it was not easy to get here every day, and they managed to do it. They managed to obtain housing. And I hear they got a car also. And So they have been able to make it here and get stable in their recovery by accessing all the other services they need. But transportation was definitely a barrier when they started. And so we started to be able to form a little bit of direction at the end of the year with all the information and data we got. Essential Express is a transportation service that was available in the end of 2020. And it was available to anyone affected by the COVID pandemic who needed a ride somewhere, whether it be to the grocery store or to work. And we got some really good data from that was shared with us. And it showed that a lot of people with children needed help with transportation. It showed that it was really a certain subgroup that was using the service, and it was in line with some of the subgroups that we identified that were affected. And so if we could go to the next slide, please. And so this year in 2021, we've started to really kind of get moving. And so we wanted to collect data, and we want data to be able to support our problem, right? And so we were, one of our members brought to our attention that there are some, that one of the transportation problems that was identified by United Healthcare was that young people ages 18 to 24 who were hospitalized and then needed to get to some sort of SUD treatment weren't able to get there. And so we started to kind of talk about what possible solutions to that could be, and if it was something that we could maybe help with. And it was very cool to me that what came out of that conversation so far is that we figured that young people need support, and they need someone they can talk to. And so we have started talking about hooking up these individuals, these young people who have been hospitalized, with a peer. So this peer would help get them to whatever treatment it was, but they would get to meet them and talk to them and share their experience, and hopefully make that individual, that young person, help them feel comfortable and be able to get them to their treatment, to where they need to go. So that's kind of where we are right now. We are just starting to put this together. And I think what we would like to do is just see how this goes. And then we could look at it. If we can have a solution to this problem, then we figured we could scale it from there. And we don't know that the peers are exactly the way we're going to go, but we would love some more interaction and some more members for our transportation committee. It's been really cool what's happened the last couple months. We meet monthly. It's the last Friday, or the first Friday of every month at 12:30, from 12:30 to 1:30. And we had talked about inviting some social workers. They might be a good contact for us to make, so that we can we can understand what kids like aging out of the foster system may need, to see if that's a possible place that we can help also, but just to kind of focus more in on this problem and see if it's something that maybe the peer solution can address, or maybe there's another idea that might be a better solution. But we're excited to keep moving forward and see where this goes. And we would just like some more people to come and join us and give us their ideas and see where this can go. So I think, I don't think I've forgotten anything, that's kind of an overview of what we're doing. And so if there's any questions, I can answer those.
Sharnay, thank you so much. Yes, if there's any questions, Sharnay would be happy to answer them. Also, Sharnay, if people are interested in joining or possibly interested in being a co-chair with you, would you like them to put that in the chat, or would you like to put your email in the chat so they can contact you?
Why don't I do that? I didn't even think about having a slide in there with all that. So I'll put my email in there, and please reach out and we can get you invited. Thanks for mentioning that, Elizabeth.
Charnay, this is Anthony Chen. I know at one time was it the Greater Tacoma Community Foundation had funded a van? Is that still going on?
I'm not sure. It was, but I'm not sure. I haven't heard about it recently, so I should look into that. It was. Are you talking about the one that goes from different, like from the Tacoma Rescue Mission to like the stability site, and then to other facilities around?
Yeah. So, and maybe someone from the Rights Services Committee can address that, because I believe they were the ones who initiated that. But the idea was to have a van that would go to where many of the homeless people lived or stayed and access services. So I see Laura Morris coming on. Laura?
Yeah, you're stealing our thunder. We'll get to it in our presentation.
Oh, okay, great. I'm sorry.
Yep.
I'm sorry.
Yep.
All right.
Good morning, everybody. My name is Melissa Haney. I am the Regional Manager of Behavioral Health Integration and Community Partnerships with Optum Care Network, formerly Northwest Physicians Network. And I was one of the leads for the medication-assisted subgroup that met in 2020. And so I'm just here today to share some of the work that we did in that subgroup with you. Could you advance it, please? Thanks. So I'll just give you a little bit of background about why the work group was created. First off, many of us have partnered with Elevate and received support to be able to do pretty intensive training with the University of Washington Ames Center on the collaborative care model, and to be able to implement that into some of our healthcare clinics. And I think a lot of people were very kind of taken with the idea of the collaborative care model. It's, for those of you who don't know, it's an integrated model that works with a primary care provider, a behavioral health specialist, and a psychiatric consultant to provide almost like kind of wraparound type services to a patient. Historically, it's been for patients who have positive screeners for mental health diagnoses, but it has also kind of become a model that has been used with substance use disorder as well. And I think one of the things that is attractive is that there's really great communication usually between the different providers, and a patient can access this care model within primary care. And as most of us know, historically, there's been a stigma for accessing care for mental health or substance use disorder, but the patient accesses this through their primary care provider. Another important piece of that is that in Pierce County and Washington State, and even nationally, as we all know, there's been a real lack of access or scarcity of mental health providers. So we've had to come up with some creative solutions to be able to address that. The collaborative care model is something that does that. And then a really big thing, and for those of you that know me know that this is kind of one of my soapbox topics, is that the Medicare population has virtually almost no access to both mental health services and certainly to outpatient substance use services for a number of different reasons. And so this model is actually, instead of being built on the behavioral health side, is built on the medical side. And so through collaborative care codes. And so it really greatly increases access for, for Medicare patients. As we were meeting with Access to Treatment group, there were a lot of different provider systems that were very interested in learning more after we had a presentation from the Harborview Clinic about the integrated MAP program that they have there, where they have a number of different providers working together to support the patients that come in that need those services. And so because of all of these things and just great interest, it was decided that we would form a work group that both behavioral health provider systems and medical provider systems could be able to learn from the expertise of models that are already standing in other areas, especially with the UW AIM Center, to learn how it is that they could potentially stand up or grow integrated MAT treatment model that they have in their own clinics. Could you advance the slide, please? So these were some of the goals that we had, again, that we would look over different types of models that were already in practice. So we had different presentations that I'll go through in a minute here, but it's also just really, an opportunity for the providers in Pierce County to be able to engage with providers. Typically they're from King County, who really know so much about this model and how it's been most effective, and to create relationships so that then in the future they could also turn to be able to ask questions and get support. And then, the other piece is, a huge piece, of course, is like, how do we pay for this? How does this work? And so again, being able to really understand how you can financially be able to create the collaborative care model or one of the other models for MAT treatment in different clinical systems. And then we also wanted to look at how to get primary care provider buy-in as well, because that's a really important piece of the models for primary care to, want to be able to participate in this and to be able to really clearly see what the benefits are, not just for their practice, but of course for their patients as well. And then the last one is that, historically, of course, there's been a lot of different models of care that have had a lot of difficulty with patient engagement and really being able to sustain that. And so we relied on the Harbor View model to be able, who's had great success with this, be able to kind of describe to us how they, what their best practices in doing this are. Next slide, please. Thank you. So these are the different models of care that we looked at. Again, the Harbor View nurse care manager model. I was lucky to be able to go there. It was probably a year and a half ago or so, and spend the day with them and really be able to see what they did and how they engage with patients, and just kind of how the model looked like while it was being practiced. And I have to tell you that, I was just blown away by how great they are with, how they engage patients, just kind of the level of those wraparound services that they're able to give them. And then just really being able to deliver the message that, everyone messes up. We've heard this from other speakers before, we fall down and then we get back up again, and they're there for them whenever that happens, that they're not shamed in any way, but they're always there. And they were wonderful. And I was so impressed with how they were able to deliver that message to the patients that they worked with. We also looked, of course, at the collaborative care MAT model from the UW AIM Center. They provided so much information about this model, answered like lots of different questions that a lot of different provider groups had about how that they could put this into practice in their clinics. And then we also heard from Eleanor Health, who's very new to the Washington scene. They are going to be providing integrated treatment for people with substance use disorder and also dual diagnosis. So they'll have MAT, and they'll have substance use counseling and also mental health counseling. And we're really excited because it is for all payers, including Medicare. So very excited about that. And then we also heard from a couple of our participants here in Pierce County about the models that and the programs that they have in place. So the health department's MedFirst program, as well as Community Health Care's MAT integration program as well. Alrighty. And then just additional information and education, more in depth, was provided by Mark Duncan and also Kelly Youngblood from the UW Ames Center about engaging providers. Addie Adwell did great presentation for us about best practices. And then UW Ames Center did billing and financial support for us. Alrighty, so this is a list of participants. There might have been even more participants on this, but these are the kind of top ones that I had down. This work group was really effort by many of different organizations, both in Pierce County and in King County, to come together as a community, which, I think that we are so great here at Pierce County and coming together as a community to be able really to work together in different systems, to be able to, build out different things that we're interested in doing and growing, like this, one of these models. So I want to thank all the participants as well. And then the support and education came from the following, especially the University of Washington Ames Center and University of Washington Alcohol and Drug Abuse Institute was a really great educational support, as well as Harborview. And then just as far as manpower and kind of making everything work, the health department, the Needle Exchange, and Elevate Health all came together along with myself from Optum Care Network to make this possible. And so we were able at the end of November of 2020 to meet all of our goals and ended our subgroup then. And I think that we got a lot of really good feedback from a lot of the different participating entities, that it was very helpful, and that they're going to be continuing to work on either implementation or growing. So that's all I have for the subgroup, and thanks so much, and hope that you all are doing well.
Thank you. Now we'll have Right Services, Right Time.
Good morning, everyone. I'm Dominic Hardiman. I am the Pierce County District Court Probation Manager / Court Resource Center Manager. And I'll let my co-chair introduce herself.
Hi, everyone. Laura Morris here. I have been recently appointed to this position as Sienna Stallings, who took over from Mike Newhouse, is stepping down. So happy to be here and excited to share with you what we've accomplished the last year.
Okay, to refresh everyone's memory, the purpose of the Right Services, Right Time Committee was to get people needed services so that they can safely manage their illnesses in a preventative capacity, rather than waiting until there's a crisis and then that situation becomes a lot more serious to deal with. So again, trying to provide as many services, getting individuals the services when they're ready to receive those services as soon as possible. Next slide.
All right, so in 2019, we set some goals based off of our conversations and meetings that we had in 2018. The first goal being to develop a clear intake tool for first responders and law enforcement. We had more representation from different departments at that time. And so when we came into 2019, it was identified that each department is kind of using their own tool based off of what they're able to do and what resources they have available to them. Whereas, Pierce County Sheriff and Tacoma Police Department have the DCRs, they're using specific tools, whereas the other departments that don't have that additional capacity are not. So kind of the outcome of that is something that, we did not look into in 2020. And it was just identified that each agency is selecting their own readiness tool. Dominic, you want to go to number 2?
Yeah, so starting in 2019, we really wanted to increase the public's awareness of the District Court Resource Center, because there's a variety of services. Again, Resource Center, the purpose of the Resource Center was to provide a variety of services in a centralized location for individuals, again, trying to address that barrier of transportation. So we find frequently in the court, in working with individuals through the court system, that clients will have a variety of needs and services that they'll need to address, and getting those individuals to each of those different agencies can be difficult. And so the Resource Center was created to address those situations. But we still feel like it's been underutilized. So we really wanted to get the word out countywide that all of these services are available. So we started to increase our advertising. But again, beginning in 2019, we expanded our advertising, but that kind of shut down with COVID in 2020. So it's really limited our ability to provide those variety of services. But that's going to be one of the goals that I get into a little bit later in this presentation.
All right, and then number 3 goal was City of Tacoma Safe Station pilot. So that began in fall of 2019, and to date we've met with 750 individuals, and 340 individuals, have opted into treatment programs that best suited kind of their lifestyle and their and what they needed. And so, that's a huge success. I also want to note Councilmember Connor McCarthy spearheading this program here in Tacoma. And we are currently working on legislation to be passed this year on safe station programs throughout the state, and it's being modeled after Tacoma's Safe Stations program. So it's been very successful. People are reaching out consistently. We get text messages, phone calls all the time. And many of those individuals, whether they start treatment with our contracted provider or the many providers that we have here in Tacoma, Northwest Integrated Health, the Meds First program, those people continue on treatment. So that's definitely a goal, is to ensure that they stay connected. The next program is the Tacoma FD Cares program. Also to note, Central Pierce's CARES program, as well as West Pierce's CARES program. So these are community paramedicine models throughout the state. Here in Tacoma, our CARES program, we've been operating since 2012. And we're really offering that case management, coordinated care service to community members to ensure they get the right service at the right time. And then lastly is TPD's homeless outreach team. I don't have many updates on this one, but they continue to do their DCR outreach, as does Pierce County Sheriff's Department. Next slide. So for 2020, our major goal, one of our major goals, was the homeless transportation project, which got off the ground on November 2nd of this year. And I will go into more detail later in our presentation and give you additional data on that piece. But it's been widely successful, and it's something we're really excited about, and something that's been a focus since we got started back in 2018.
And the Resource Center, we continue to advertise in 2020. We're looking to, again, expand, and I'll talk about that a little bit later, about what our plans are for more advertising. But currently what we do is we send out a daily email listserv to a variety of agencies and partners, letting folks know what services are available at the Resource Center that we can connect your clients to. Next slide. Again, in discussing some of the goals for 2021, we really want to increase the utilization of the services that are available at the Resource Center. So we're looking at creating some videos through Pierce County TV, having some videos looping in the courthouse, which is where the majority of our clients are going to be coming from. So providing video streaming at the courthouse and in the Resource Center, making folks aware, making the public aware of the services that are available at the Resource Center. Also wanted to note that the Resource Center is now in its new location at 925 Tacoma Avenue. So that's right across the street from the courthouse. So as you walk outside of the main entrance of the County City building, you can see the sign that says Court Resource Center. So we're out of the Hess building that many people on this panel today have indicated the old building was spooky and looked abandoned. So now we have a dedicated space that is much more approachable for your clients to send them our way. So hopefully this new building won't be as scary for individuals that get referred. We're also looking at virtual appointments. We're finding we've had to really adapt to the pandemic. And what we want to do is provide kiosks for virtual appointments. So not all of our partners are going to be coming back, even though we are open. We opened on Monday. Not all of our partners are going to be coming back there. They have their own pandemic timeframes for when their staff will be coming back for in-person appointments, but we still want to foster those appointments with those agencies. So we're looking at installing kiosks for individuals who do not have access to smart devices. So we're looking at installing about 6 of those in the hope that individuals who, again, do not have smart devices can utilize those kiosks to make connections with some of the partners that we have. We want to continue to explore MAT partnership with Tacoma Pierce County Health Department. That was something that we had a discussion about, but again, with COVID kicking off, we never got the opportunity to kind of really dig into that. We want to continue to work on, and this was a new project that started actually last year as well, was developing a process for getting ID vouchers along with getting individuals who are homeless ID. We were approached by the Tacoma Police Department. The Resource Center was approached by the Tacoma Police Department and trying to assist individuals who are homeless that they come into contact with who want housing but lack ID to get housing. So, and right now through the pandemic, there's a long waiting list before you can even get into DOL. So we had worked something out with DOL and with the SHS and getting the ID vouchers and setting up an appointment for those individuals at DOL to get the ID. On top of that, with the shuttle, the new shuttle, we were going to have individuals actually be able to get picked up and driven to DOL to get their ID. Again, with COVID, that we had to shut down and the Resource Center was shut down. We just reopened. So we hope to get that ball rolling again, because I think that's going to be a big need that we can fill. And Laura will get into the discussion about locating funding for transportation. Or Marissa and I, when we get into the breakout rooms, we'll talk about funding the shuttle program, as that funding will soon be running out. And as always, the Resource Center is always open for new ideas, new services, new partnerships. We welcome anybody to come in and bring your ideas. I'm hoping to get a few new faces to come into the breakout rooms and offer some new ways of thinking, new ideas. So please, I'm hoping you'll be willing to step up. Next slide, please. And again, I explained what the purpose of the Resource Center is, what the goal was, providing centralized services in one location. Next slide. And this just describes, there's various ways we typically get individuals into the Resource Center. One of those ways is you can walk in. People see District Court Resource Center and they may think that you have to be justice involved or court involved to access the Resource Center. That's not true. It's open to anybody. It just so happens that the court, District Court Probation is the program, or District Court is the program or the agency that is currently running the Resource Center. So you can walk in off the street. Next slide. It can be a jail referral. So individuals can utilize the kiosk within the jail and they can indicate what services they would like to access. Next slide. A large number of those individuals that do get referred to the Resource Center come through our probation department. Next slide. In the services that are provided, this is kind of in a nutshell, everything that's provided in the Resource Center. Again, we wanted to make it easy for individuals, in particular those individuals that are getting out of jail, who may have no contact orders where they can't go back home, they don't have clothing. We really wanted to provide a lot of services that they will need to get off on the right foot. So we have housing assistance, we have a clothing bank that I'll talk about in a moment. We have our alternative programs that can help an individual pay off fines. We have medical assistance programs, we have employment services, and we have DSHS. Next slide. Within our housing providers, we have several housing providers. We have Catholic Community Services that they do the coordinated entry. We have Pioneer Human Services with a new program. They have a housing navigator and support services. We garnered a brand new partner just this year, and that is the Wellsprings Family Services. I believe they're out of King County. And one of the original partners from in the creation of the Resource Center, the Loss of Living Access Support Alliance. Next slide. Our clothing bank, we really call this the draw. This is how we draw individuals in off the street. It's probably our most utilized service. It's available to anyone. The great thing about the Resource Center and the clothing bank is you can put in a phone call to the Resource Center. If you have somebody that's going into inpatient treatment and you want to get a clothing packet together, you can call and the volunteers will put that together. That has worked out really nice. That's something that's utilized frequently by the defense attorneys as they have clients that may be getting out of jail, going into inpatient treatment, and the client may not be comfortable going into inpatient treatment with just the clothing they have on their back. So again, that's a need that we can fill. So this has been the biggest draw, and we call this a draw because we want to draw people in, but we want to expose them to all the other services that are available in the Resource Center. Again, the Resource Center and the clothing bank are available to anyone. Next slide. Our alternative programs. These programs are available to folks who are justice involved. So these are going to be individuals that have had tickets, that may be holding up their getting their license. And so they can pay off their fines by either participating in our work crew or our day reporting program. Next slide. Medical assistance that's available. We have community health care. They provide the Medicaid enrollment. We have Pioneering Human Services. They do drug and alcohol assessments and mental health assessments. We have Asian counseling and treatment services and multi-care, and they both provide drug and alcohol assessments. And the newest service, again, is the medical transport shuttle. We are one of the drop-off and pickup locations for any individuals that are homeless who need to get to service providers. Next slide. We have employment assistance. Our primary partner is WorkSource, and they do monthly Employer of the Month events. And so these are going to be second chance employers doing employment events, hiring individuals right on the spot. Next slide. And then we have our DSHS. Again, we have Social Security navigation, cash assistance, and relicensing program to pay off tickets. So all of those services are provided by DSHS at the Resource Center. Next slide. And so again, the importance of the Resource Center was to really connect with partners, have partners connect, get individuals connected with multiple services in one location to share information. We want to respond timely to the needs of the individuals that come into the Resource Center. Too many times we run into individuals who are ready for services, they're ready for MAT, but we end up scrambling trying to fill that need. And the Resource Center was one of those ways that we had hoped that we can fill that need when that person is ready. And I will turn it over to my partner now. Next slide.
All right, so the transportation project. So the Right Services, Right Time Committee, like I said, in 2018, this was really a major focus of ours, is getting people to the services that are available in Tacoma, Fife, and Furcrest specifically, you know, kind of the central hub of Pierce County. So we worked heavily with our partners in this committee, Pierce County Alliance, Catholic Community Services. But during this year, 2020, COVID happened. So a lot of things changed and things weren't able to be implemented as quickly or in the plan that we had originally set in early 2020. So the transportation project, like Dr. Chen said, is funded by the Greater Tacoma Community Foundation, as well as Coordinated Care provided us seed money to get this project started. So I wanted to say thank you to both of those agencies for the support of this project and with the Right Services, Right Time Committee. Specifically, we're focusing on transportation for unhoused residents. So this is individuals that are residing at our shelters or clients that are coming out of jail. Transportation is primarily to medical clinics, pharmacy, outpatient treatment clinics, and other medical clinics throughout Tacoma, Fife, and Furcrest. And the shelters are listed there that this transportation van stops at regularly. So this is kind of the route it stops at. And it can take anywhere from an hour and a half to 2 hours to make the full route, depending on how many riders are being picked up at each shelter site and where they're being dropped off at. I wanted to read to you our most recent drop-offs for the day. So we had Northwest Integrated Health, Raphael's Medical Clinic, and then Tacoma Pierce County Meds First program. So this service is taking people directly to those opioid services to receive treatment, and it's operating exactly how we had hoped. Next slide, please. So the unhoused transportation barriers, the biggest thing is a lot of individuals don't have cell phones, and now that the libraries are shut down, they no longer have access to internet. So scheduling with rides with paratransit or the shuttle is limited. I came into the office this morning and had received a text message from a patient of ours who wasn't able to schedule paratransit yesterday because they closed at 3:30 and they had received notice of an available appointment at 4. So that's just one of the barriers that our individuals that we're serving are coming up against. Again, or additionally, there needs to be a 24-hour schedule notice, which is another barrier for people that we serve who have medical needs that arise without notice. And then next is the money and ability to pay for a bus pass, a taxi or Lyft, taxi and Lyft being fairly costly. Next slide. So this is the handout cards. These were provided to every shelter on the list, as well as these other locations throughout the city to hand out to people. Our first goal was 30 to 60 minutes, but as we had increased ridership, 30 to 60 minutes is taking about an hour and a half to 2 hours, or excuse me, an hour to an hour and a half for the stops to be made. So this van is operating from 7 a.m. to 4:30, and then all of the stops that are available to people are there on the right. So no appointment necessary. The van's gonna come to the shelter and then you just jump on and let the driver know where you wanna go, and the driver will take the individual to one of these set locations. Next slide. So as of February 22nd, we've served 644 unhoused residents. We've completed over 1,500 trips. We've served Medicaid and Medicare clients, and a big component that us as the fire department are concerned with is the reduction of 911 responses to the shelters. So this service is providing a prevention oriented measure that people can select and be able to use so that they can handle their medical complaints or attend appointments as they need to and as they're ready to. So they're no longer waiting for that 911 emergency to occur or the need for to visit the emergency department, which is great. I think the biggest component is the 60% of destinations are to an outpatient clinic. So if you give people the resources to make decisions for themselves, they're going to make decisions to attend those medical appointments and be able to schedule those medical appointments and feel comfortable being able to attend those medical appointments. So I think this project has been fantastic, and I know our riders are extremely thankful. Our driver gets thank yous all day long, so it's great. Next slide. So I actually just found out from our contracting department that this is not set to sunset until the end of April. So we have 2 months, a little less than 2 months, but we are asking for help to sustain funding for this transportation model. We have reached out to HCA Paratransit and they declined to assist. So any suggestions that our partners have to continue funding this model would be appreciated, and that's something that we're gonna discuss further in the breakout sessions. But I hope the data reflects how successful it's been and how needed it is, and especially for our unhoused individuals. And now that Dominic's open and we'll have more people released from jail coming through his building, it'll be a huge a huge opportunity for them to be able to receive the services and get to the services that they need to get to. And with that, if there's any questions.
All right, thank you so much for that wonderful presentation. I'm going to hand it over to Kim Beeson to talk about the Prevention Education Committee that I happen to co-chair with Kim.
That's exactly right. Thank you, Elizabeth. So you've got both of us here, and Elizabeth is always available for any follow-up. You can see that we have about 14 committee members, and so we just leave them here as a reference for you so that you're aware that we have a lot of different CBO and some school education and county representation. I have just a couple of slides to go through. Let's take a look at the next one, which is about our priorities. And we established our priorities pretty early on in the game, and they are deep and extensive for us. So we continue to concentrate on that. I want to give a nod to Trevor Higgins, who helped us with the use of his strategic prevention framework to really explore and cement our critical issues, which you can see here are related to implementing inside of our school programming those evidence-based curriculum and awareness campaigns, materials, and even some networking and referral sources. We are doing that also by reaching out to a variety of other audiences through some community outreach, education, and social marketing. We use a variety of, we're really brokering a variety of things that already are existing out there. Our student assistance specialists and family liaisons, et cetera, and learning how they're impacting. We use our coalitions and their social marketing techniques to really leverage our messaging. We're utilizing peer recovery coaches. Now, actually, that's not exactly true, but we have that as a priority, and that's a focus that has taken a back step to the other things just for the moment, but we do have exploration on how to use recovery coaches. We recognize that as a really a great value for our kids. There are policy and practice navigations to engage in, and so that one is still looming in our future. We've made an approach to a number of different schools. We've prepared a letter to superintendents and school districts identifying our interest and engagement in creating a cohesive resource for them for comprehensive social emotional supports, of which opioid prevention and other substance abuse preventions and mental health supports are all a part of. And that can look at how we provide support for staff, classroom instruction, links to the mental health, behavioral health resources, and school policies, as well as parent and youth engagement. And so that high school pilot was just about looming once COVID hit, and we are engaged in finding a way to start that up with the comfort and comprehensive view of all of the social emotional needs that exist inside of our schools in the near future. And then of course, our focus is on addressing the anti-stigma. So we are working towards increasing acceptance of our understanding of substance abuse as a disease. And that messaging is throughout our education and outreach projects that we're supporting, and that also are leveraging that already exist independently through other systems of support, such as coalition groups. Of course, the phone rings. So let's take a look at our next slide, which is demonstrating what our focus is on. And this also came out of that strategic framework work, is that we recognize that the critical goal for our communities is to prevent harmful behavior. We've taken a lot of steps to pull out of opioid specific language and assure that opioid prevention and is recognized as a component of trauma, of ACEs, and of all of the various continuum of mental health needs and supports that exist in our community and with our families. So this goes on to say that prevention activities is a priority for us and that can occur in various contexts, including the family, our peer network schools, our community-based organizations, and then our broader policy work. We are especially working with a very complex system inside of our educational programming to send those messages and support messages that they have. So that's the efforts that we're focused on. If you take a look at our next and last slide, we'll let you know a little bit about what we have done this year and what we're up to for next year. Let's just start with a moment of lessons learned. I don't know, I think we had some really fantastic presentations just now from the other committee work. I'm impressed that all that's been done, but the pandemic and just for youth being able to stay in school and stay connected is a tremendous challenge. And so it has provided a challenge for us to approach and make sure that our messaging with schools is cohesively attached to their overall messaging rather than as a priority, as a competition to their time and all that they have to do. And so that's, as a consequence, we're working with some districts more than others at this point in time. But change and priorities take work even in the best and even in non-unusual times. So coming back over to our accomplishments, what we have done is updated our priorities. We've refocused on our landscape by looking at our needs assessments. We've shifted our work course to work in connection with our virtual communities and re-identified who our key stakeholders are. We have expanded our committee. I believe Elizabeth can correct me, but I believe we were about 8 or 10 strong, and now we're about 14 plus strong. We really appreciate the work that Trevor did in helping us hone some of our messaging. We'll continue to need to seek new members. We've assessed and identified key areas such as social emotional learning. You've heard me say that a few times. And a couple of things that we've done in developing our key messages is to work with already existing communities, such as recently at my institution, I should have introduced myself. I'm Kim Beeson with the Puget Sound Educational Service District. And through House Bill 1216 a year ago, we have been able to recently hire a behavioral health navigator. And she is doing assessment district interviews to assess the full continuum of mental health and behavioral health needs. And so we're incorporating the Opioid Prevention Task Force questions into her work. We're also working with her and her name is Lane Crumpus. We're also working with her and the county and Michelle Heyman over at the county and others to create focus groups with our community-based organizations. And those focus groups are really concentrating on learning ways of bridging the gaps between identifying youth and families in need and referring. And so there's some gaps and there's some challenges between the school referrals and the warm handoff over the community-based organizations. And so we will be having a series of focus groups, and we will be having some results come out that will drive our work coming up in the next few months. So that plus just brokering a lot of the existing trainings and awareness components, things like there's a Tall Cop Says Stop, Hiding in Plain Sight, Youth Mental Health First Aid trainings. Those are the kinds of examples of that, how we are assuring that we're a part of the cog that creates good connections between resources and the needs of our schools and youth and families. And that's all I have for us, Elizabeth.
Thank you, Kim, so much. Really, really appreciate it. And if anybody's interested in joining the Prevention Education Committee, Kim and I would be very, very happy to have you join us, definitely. Well, moving right along, I know that we were ahead of time and now we're behind time, which is great. We had so much wonderful information here this morning. without further ado, I'd like to introduce Stephanie Wood, who works for our assessment planning division at the Tacoma Pierce County Health Department. Stephanie.
Hello, everybody. Good to see all of you today. My name is Stephanie Wood, and I'm a program analyst for the health department. You also might recognize me from last year. So it's good to see all of you and many familiar faces. So let's get started. Next slide, please. All right, I'm going to go off screen just so I can focus, okay? Thank you. Okay, today we're going to look at local data trends and some successes. We're going to particularly think about the context of the COVID-19 pandemic. I'll be using opioid poisoning instead of overdose to reduce stigma and align with terms used for alcohol and other substances. I'll often use rates, and rates make it possible to compare trends among different sized populations. This summary is short this year, so as you know, we'll be holding off on questions, but email me with anything pressing and I'll do my best to help. And as you know, this session is being recorded. Next slide, please. Great, so many of you saw this slide last year and I'm going to unpack it. Data helps us understand where the opioid epidemic is most burdensome, how it changes over time, who is most at risk for opioid poisoning, and among them, who is at most risk of death? And then how are local efforts impacting opioid use disorder, or OUD? The data often comes from medical claims, prescription monitoring, emergency response, and death certificates. Sometimes it includes case management data like treatment services and community programs. Poisoning deaths are the most extreme symptom of the opioid burden, but also affects the fewest people. And for every person who dies, many more experience OUD, even more at risk for misusing opioids. This is also true for the burden of resources to respond. So for every person who enters hospital services from poisoning or accidents, many more need intervention. Thousands more experience family problems and legal trouble and disrupted lives. Adverse child experiences coupled with adverse community environments, known as the pair-of-ACEs, can place people at a higher risk of OUD harms. I know that's been talked a lot about today. So today's summit is considering the intersectionality of COVID-19, and many at risk for COVID harms are also at high risk for opioid-related harms. Next slide, please. So no crisis happens in a bubble. Pierce County residents have been experiencing various personal and collective, direct and indirect trauma. COVID-19 continues to bring the emotional and physical stress, grief and loss, isolation and disruption, hardships and uncertainties. And seeing Ahmaud Arbery, George Floyd, Breonna Taylor, and Manny Ellis plead for their lives in death recycles trauma for Black, Indigenous, and people of color. They ongoingly struggle with the effects of structural racism. Wildfires drove us further indoors with unsafe air quality. There's also trauma from seeing communities or loved ones experiencing devastation from natural disaster. Next slide, please. Great. So opioids, like as we talked about, there's much intersectionality in harms between COVID and opioid use. Poor health from OUD can worsen COVID's health effects. Harms from COVID can increase risk of death. Anxiety and depression can increase risk of misuse or worsen OUD. Poor life circumstances caused by OUD can worsen COVID harms. For example, being incarcerated can increase risk of infection. And then deaths of despair are more likely. Next slide, please. A survey asked Washington residents about their legal and illegal opioid use. 20% were using an opioid of any kind for any reason. Both misuse was fairly low, but higher than the state. Among opioid and stimulant users surveyed, about 15% wanted assistance. Next slide, please. In a survey of Pierce County 10th graders, opioid use was slightly higher than the state. When prescribed opioids were unavailable, youth seemed to seek other sedating substances. So this will be interesting to follow. Heroin use was very low, but as prescriptions become more limited, heroin can become more common. Other data show that our young adults are nearly twice as likely to die or be hospitalized from opioid poisoning than people over 50. And about half of 2019's surveyed needle exchange users were initiated into injection drug use younger than 25. Next slide. So thinking about crime. Crime case trends might be influenced by attention to distribution and diversion of nonviolent users. Crime lab cases are a combination of who gets arrested, which cases get prosecuted, which items may be sent to the lab, and if there's enough quantity to be tested. Opioids includes heroin, and opioids may be legitimately used for pain and or OUD treatment. This slide means to say that 2017 through 19 is compared to 2002 through 2004. Any opioid cases, and especially heroin, were up. Synthetics and fentanyl cases are rising, but there's no 2020 data yet. Any opioid growth is outside of Pierce counties and outside of King and Snohomish. And as you can see, it's growing particularly in the rural counties. 2020 also shows increase in narcotics violations. Incarceration may normally rise, but there's been more early releases to minimize COVID risk. Next slide, please. So last year, Pierce County deaths were flattening along with the state and curving downward. We seem to be really making progress in 2019. However, 2020 is recording an alarming high that's consistent across the state. Now, I want to make it really, really clear that the 2020 numbers are very preliminary. They're mostly missing the last quarter, and not all toxicology labs are back. So I want you just to be very careful in how you interpret this. But you can see it's giving us a little insight to how the 2020 is becoming a record year. Both Pierce and the state have seen dramatic increases of psychostimulants. We talked about this last year, but we may be leveling off. However, we don't have 2020 data yet to really know. Next slide, please. Thank you. I'm sorry, but this is the most reliable data at this time. Whites and males had the most poisoning deaths. American Indian, Alaska Natives continue to have the lowest number of deaths, but the highest rate of deaths. And our rate of heroin deaths outpaced the state. It may be leveling off, but again, it's too soon to tell. And it may be higher since heroin can be absorbed before labs detect it. While we may still fall short on prescribing benchmarks, we'd continue to fall in deaths. And this is likely to interventions like medication take-back, prescription monitoring, reducing chronic or high-dose prescriptions, which you all have been working very hard on. Now, deaths involving illicit fentanyl jumped in 2017, so you can see synthetic there. And it really took off in 2019. We might still be behind the state, but it's much more in 2020 than other years. And you've all been talking about this in your anecdotal data. We've seen clustered spikes in reported fentanyl-related poisonings and needle exchanges, treatment services, and among loved ones. And it's been consistent with the high demand for naloxone kits and refills, particularly in May and in August. Next slide, please. Thank you. Essence data is preliminary data for hospitals, and diagnosis can change during disease course. Information is often added when patients leave, and reported times can vary among facilities. Opioid reversals are gathered through self-reported patient histories and may not have been performed by providers. So they may have happened at home or wherever the poisoning happened. Now, there's not been a dramatic difference in hospitalizations. However, despite your increased Narcan or naloxone distribution and reported reversals, the number of 2020's visits has been close to 2019. Fear of the virus may also keep people from going in. Now, the synthetics surpass heroin hospitalizations. The high prescriptions might be related to fentanyl-tainted pills. I'm not really quite sure yet. It'll be interesting to see if and how the jump in prescribing during the second half of 2020, how that might be contributing. Now, higher rates continue among American Indian, Alaska Natives, and Black African Americans. And I talked about this last year, and it's consistent this year as well. Next slide, please. Thank you. So emergency medical system first responders, as you know, as we talked about today, have a very unique perspective. They document circumstances, including where and when and how they happen. Our EMS, emergency medical system, agencies don't have a shared data bank, excuse me, like other counties, but the State Department of Health has a voluntary data bank called WEMSIS that many agencies are adding into. So looking at 2020, impressions and reversals spiked kind of about quarterly. We do see spikes consistent with anecdotal reports in the spring, fall, and early winter. And it seems to be falling in midwinter and towards late winter. Now, please note, this is also very important. In 2020, more EMS agencies joined WEMSIS. So you can see that dramatic change from 2019 to 2020. It doesn't necessarily reflect an increase of calls. It's just that more calls are being captured in WEMSIS. I tried to kind of show that in the top line there in that yellow. That's when we were really averaging about 90%, 93% of recorded cases were going into WEMSIS compared to 2019, where there was really just estimated 61 to 80%. So just be really careful in how you interpret this, please. But I think once we have data for a few years, we're going to better understand these call trends. Okay, so go ahead and go to the next slide. Great, thank you. So just adding a little bit more context to hospitalization or accessing services. Among persons surveyed during the needle exchange services, more than half didn't access needed care out of distrust or to avoid judgment lectures. I know that's not surprising for a lot of folks here. Most had neither health care, what I'm trying to say is most had either no health care or Apple Health, yet only 8% avoided care because of costs. So that's saying something as well. That's pretty consistent with the Washington level, which was about 10% not having health care or only getting Apple Health. And then among those that went to hospital, 60% had one or more emergency visits, and 41% of those had 3 or more emergency visits. So that's giving you a sense. Now, taking a look at injection drugs, drug use, injecting drugs, can lead to endocarditis, abscesses, bone and joint infections. So I looked at some hospital abscess data as well. And about 40% of any drug-related visits included abscesses or cellulitis. And heroin was the most common injected drug. And then 45% reported injecting muscling or injecting pockets into the muscle or under the skin. So sometimes folks use that technique in order to stave off withdrawal. Okay, next slide, please. Thank you. So these are some benchmarks that impact harm from opioid use, and Elevate Health presented this last year. This is an update. So compared to 2018, we've really made improvements in every category, but we're still falling behind the state. And the Washington Healthcare Authority reported that we only have 27.7 waivered MAT providers per 1,000 Medicaid enrollees with OUD. Now the state average is 46.6. I know this was talked about earlier, but there's some data for you. And coming in the home stretch here, I'm just going to talk about the local data sources. So they may not always be as robust or timely, standardized or accessible, but they really tap into the needs and characteristics and traumas, as you can see below. Also why certain harms are happening, supply and demand for services, and of course, less celebrated successes. And these data are from the Needle Exchange, the Health Department, Catholic Charities, and the Pierce County District Court Resource Center. Now, the Resource Center anticipated increases in clients and visits, but COVID shut them down for most of 2020. I think you've probably heard about that. Partners saw a decline in referrals as well, and other services like employment, drug and alcohol assessments, mental health assessments, and housing. And then the demand and distribution of naloxone soared despite severe limitations in service access. Needle Exchange had to change to order in advance deliveries. The health department had to move indoors during COVID and wildfires. So going inside automatically reduces access to clients. Mobile crisis encounters and access to potential clients in shelters and street outreach was highly limited by various providers, but as you heard about today, there's a lot of efforts to move around these challenges. Okay, next slide. So in closing, and I'm just kind of posting there some of the successes and the approaches that you partners have taken on. Pierce County residents have shown incredible resiliency. It's important to note that. Also continued infection control measures, racism, and other life factors will continue for the foreseeable future. And as a result, the snowballing need for an expanded and nimble network of providers and systems will continue. So this year also brought new opportunities to re-examine and adapt policies and procedures. You've all had to navigate your services around shutdowns, shut-ins, set-asides, and workarounds. Many of you talked about challenges and meaningfulness of connecting to clients when you could. Your attempts to stay nimble reflects your dedication to serve those that need you. Thank you for your service, and enjoy the rest of the summit. So good to see you today. Thank you. On the last slide, you'll see my, my email address and my phone number, so you're welcome to contact me. Thank you.
Thank you, Stephanie. That was a great presentation. I appreciate everybody hanging on. Obviously, we're running late today, so we are not going to do the breakout rooms. However, I am going to put the questions in the chat because we do want feedback. And so if we could take just 5 minutes to maybe think about these questions, what work still needs to be accomplished? What is our priority? What should be our priority? What barriers need to be addressed? Who needs to be engaged in this work to move us forward? Those are very big questions, and I'm hoping that as you've sat and listened to our presenters that you may have some thoughts. So please, if you do not want to speak, please put them in the chat. We will be sending out a survey, so we'll have some more opportunity if you need some time to be thoughtful about some feedback, but this is what we were going to be doing in the breakout rooms today. So, and we are looking in the chat. Stephanie, you're getting lots of thank yous.
Well, I know I went a minute over, but boy, you've all been asking for more data, and I really wanted to give you more data than last year and more thorough. So I hope this was helpful. Thank you.
It's definitely different doing it on Zoom. We don't have to, it's just a lot more barriers for us to actually talk and be able to spend time networking. We definitely were going to keep the Zoom up after our final remarks. So those of you who want to maybe have some conversations, you can as best as you can over Zoom, with 84 people still on the line today. That's great. Okay, I'm seeing some questions, some comments here. Addressing stigma and reaching out to underserved communities to share information to engage in supports and service. I totally agree with you, Candace. Is there a plan to share the presentation and set time and Zoom link for those that might want to meet as breakout groups? I think that's a great idea. We could certainly set up some times that people want to come back and talk. Well, Elizabeth and I will definitely talk about that. Can that data presentation be emailed or posted to committee members for later use? Elizabeth, I'm assuming that's a yes. I see her nodding. Yes, on addressing stigma. Yep. Lots of thank yous. Stephanie has her email in the chat for those who are interested. Our youth are a big part of who we need to help through this, for sure. Well, thank you for those comments. Please be thinking about it, and we'll be sending out some more information for some additional conversation times. And I'm gonna hand it over to Elizabeth.
Yeah, thank you everyone for your suggestions today, your comments, your questions. Keep those coming, please. I know that we had a lot of wonderful information and speakers today. With closing, I'm going to hand it back over to Dr. Anthony Chin, our director at the Health Department, to give some closing remarks. And thank you once again, everybody, for your time today. Really appreciate it.
Thank you, Elizabeth, and thank all of you participants. It's so good to see all of you on the line and passionate about this issue. I think our summit today was really bookended by the two very important things. On the tail end, Stephanie told us about the numbers. What is the compelling data behind why we are doing this work? And on the front end, our keynote speaker told us really, what is, in the words of John Lewis, the moral obligation, right? And the passion, and that it's what lies within us, and that we have to do something, we have to say something, we have to speak up. In between, you heard a lot of the, oh, and by the way, just wonderful insights from the youth that Joan Bouquet brought with her. I like what she said about after the storm, there is the sunshine, there's hope in what we do. We're in the middle of the storm, but we can see the hope. Taylor Woodruff, I'm going to turn 60 this year. I might call you up to get a skateboarding lesson, but all those messages about fun and engaging people, how we have to address their issues, how important the plays to student success and how it cultivates values in us as we move forward. You've heard from our committees about the work that they're doing, about making sure that people have access to treatment, helping the providers actually implement that, helping people get to their treatment. Right services, right time coverage, so many things. I think everyone knows how housing, transportation, and jobs impact people's ability to participate in recovery, but who would have thought that they need ID cards and clothes, right? But of course, the Right Services, Right Time Committee has thought about that. And of course, some of the data you saw was that our deaths may not be going up that much, but some of that's probably because of our naloxone distribution, kind of tertiary prevention, kind of, just literally saving people from death. But we're trying to move that further upstream. I mean, access to treatment is more of a secondary prevention, but our prevention education committee is really working on that primary prevention and hopefully helping us lead towards wellness. So I think just so much energy on the summit today. Thank you everyone for being here. Thank you to all our presenters. Our communities deserve action. We deserve a comprehensive and coordinated system to respond to substance misuse and mental health. And with that, of course, thank you to Kim for facilitating this, and to Elizabeth and the Cheyenne, the other staff behind the scenes. And with that, thank you all for coming, and thank you for your dedication to the community.
All right, well, thank you, everyone. We do have time here to have some networking time as much as you can on Zoom. But we really, really appreciate you coming today and enjoying this different kind of summit virtually. So hopefully next summit, we will see you all in person.
They're such a quiet group. Considering there's still 55 people left on the screen.
This is a great time. If there was something pressing that really just, made you think, if you want to share anything.
I see so many. I see Kirby Pollard. I see names I know. It's great. Derek Murphy.
Good afternoon. I'd like to, I think can everyone hear me? This is Sylvia Cipriano.
I hear you, Sylvia. You're very quiet though.
Okay. Can you hear me now?
Yes.
Okay. I was just thinking outside the box. What would the possibility be of, I know right now everyone's struggling with trying to get IDs. They might have an ID, it might be expired. I mean, I know that's something that has been extended. I think having no wrong door. Let's figure out how we can help the person. I know that in some programs that are affiliated with, I guess, the access point system of the homeless management programs that are there. At one point, we were able to upload important documents so the clients that we were serving, in case they lost them, we would be able to retrieve them from there. And since most people who are homeless have to go through one access point, I was wondering how or what we could do to maybe be more helpful with that, understanding that right now people can't get to the DMV or they don't have the money to pay for things, where we could maybe print out something for them. I know that in some shelters they give them kind of like an ID to enter, but I mean, I know it's not a government ID, but it's an ID to say, hey, this person's already working with several programs. Let's kind of keep them on the radar. Let's give them some help.
So to recap that, Sylvia, it sounds like what I'm hearing you say is ID access is a big issue. And I know this from working in the hospital. If people don't have an ID, you can't get them sometimes on the bus or other transportation, or it limits them to access resources. And at this time, due to COVID, the limitations on people able to access and get IDs, that you're hoping for an alternative potentially to be considered, that if somebody's engaged with supportive programs, that should give them an increased access to resources. Am I understanding you correctly?
Pretty much what you just summed up.
Yeah. I think that is definitely thinking outside the box, because there's so many regulatory pieces that go into identification. but I'm going to throw that out to other people for discussion.
And I don't know if Dom and Laura are still on, but we will get their information in the chat box too for a follow-up. Charnay's still here. Yay.
Oh, she's all excited. She's ready.
So she's ready. Good. Thank you.
I have changed into running clothes, so that's the going to do that after this. I didn't hear, it was kind of quiet, but DSHS does do, and they had not had a way to do it for a minute because it used to be you go to DSHS, they'll give you a voucher and you pay $5 for your ID. They weren't mailing those out at the beginning of the pandemic, but they have now figured out how to do that. So if you receive services at DSHS, you just call them and say, I need an ID voucher. They'll mail it to you. And then you have to schedule the appointment with the DOL. Sometimes addresses are an issue, and like we found ways to deal with that. You know, if someone doesn't have an address, but I'm really grateful they figured out a way to get people the voucher for the ID, because $5 is a lot more manageable than 20 oftentimes. So I don't know if that helps at all, but I just wanted to throw that out.
And I'm looking at Kathy Ryan, who's on the chat. She says, do not send them to the emergency department thinking that the hospital can get IDs for people, because we cannot do that. I agree with you, Charnay, because when I worked with Nativity House and we would have our medical respite folks there, the $5 and getting the ID through DSHS was a process. So I will say we are running out of time, so this is a good conversation, Noah. And when we schedule our breakout rooms coming up, we'll definitely bring this one to the table. I'm just looking to see if there's any other questions or comments.
And Sylvia, Dom put his email address in the chat box. So I'm sure that he's looking for more people who want to work on his committee. So please contact.
Yes.
Will do. Thank you.
Expect us to be reaching out to you. We really want to give new breath, new energy to the task force, and really hone in on key issues that we want to address. So don't be surprised if I'm calling you, especially those of you that know me. This is good work to be doing.
And in fact, what I said, if there's anything in any of the committee presentations you heard that you're interested in, or I've seen a lot of good comments in the chat box, please reach out to the committee chairs. I'm sorry, we didn't give Paul Lukowski any airtime on my committee, but either reach out to our committee chairs directly or reach out to Kim or Elizabeth or Cheyenne, and we can get you connected to any of the committees.
Just put my email in the chat, Elizabeth, if you may want to do that. I think our slides had that information at the end, but we'll make sure those slides get posted for folks to be able to access. All right, folks. Since I don't want to keep people on longer than they have to be, I want to thank you all for such an engagement of folks and great presenters, great stories, and just really inspiring. So, and just we look forward to next year, be in person. That's our goal. So, Elizabeth, any other final thoughts?
Nope. Thank you, everybody, so much.
All right. Take care.
Thank you, everyone.
Wonderful.